So our speaker today is our fellow Rotarian and Dr. Jack Rhoads. He's a retired thoracic surgeon at WellSpan at York Hospital. His presentation is entitled The Progress of Medicine in the 20th Century. There has been a remarkable progress in medicine, and Jack will discuss a few scientific developments of the 18th and 19th century and the state of medicine in the 1900s as a benchmark. He will highlight certain advances of thought in science and multiple developments, improvements in medicine and surgical throughout the 20th century. And Jack will finish the presentation with a few words about where we are now, and perhaps if you have good questions and he has good answers, he'll talk about the future. Jack was born and raised in Philadelphia. He graduated from Germantown Friends School, Haverford College, and Harvard Medical School. He interned at Cincinnati General Hospital and did his surgical residency at the University of Cincinnati. He is board certified in surgery and thoracic surgery. He came to the York Hospital in 1985, and I'm really pleased to say this part. He joined Rotary in May of 1986. So shortly after coming to town, he thought that Rotary would be a good extension of his experience here. He retired from WellSpan in 2014. Fellow Rotarians and guests, please warmly welcome Dr. Jack Rhoads.
Well, this talk is inspired by a classification talk I heard some years ago, in which the speaker touted all the good things that had happened in his area of endeavor, and I said to myself, a lot of good things have happened in medicine that would make a good talk. So I gave a talk a few months ago, and a woman came up to me afterwards, and she was effusive in her praise, and she said to me, she went on, and she finally said, it was simply superfluous, she said. And she continued, she said, you should have it published, she said. I said, well, I might allow it to be published posthumously. Oh, the sooner the better. So I want to set the stage for what happened in medicine and biological sciences in the 20th century. And you'll see on the slide, the first thing I say is that the vaccination against smallpox, I think it was in the 1600s that Edward Jenner did his work. I was in London at the British Medical Society's headquarters, and I had lunch there, and there's a full-length portrait of Edward Jenner that you walk by in that facility. The microscope was invented in the 1790s, and with the microscope, people could see that the human body is made of individual cells, and it's not a large matter of continuous material. Genetics were developed by Gregor Mendel around in the early 1800s, and that came to be important in the 20th century, although it was forgotten for a good many years in between. In the 1860s, Louis Pasteur developed a lot about bacteriology. He also had a vaccine for rabies. The French physiologist Claude Bernard pointed out that the cells of the body live in an internal milieu which is consistent and which is important for keeping them healthy and so that they can function properly. The germ theory of disease was developed or enunciated by a German scientist named Koch. Lister developed what should be read as antisepsis in the 1890s. X-rays were discovered by Röntgen in 1894. And it was a very short period of time before they came into clinical practice, so the X-ray machines were made. It was maybe 10 or 15 years. It was possible to have X-rays, which absolutely revolutionized care of lots of things, because you could see parts of what was going on inside the body. In the 1890s to 2000s, Madame Curie was isolating radium from pitchblende, and that became important therapeutically in the 20th century. But somewhere in the late 19th century, and I say here the 1880s, electricity was developed so that it could be made available to everybody. And none of what we've done in the 20th century would be possible without it. So you need it for light, you need it for diagnostic instruments, you need it for therapeutic instruments and tools, the elevators in the hospital and everywhere else, and refrigeration to keep food from spoiling and to keep specimens from deteriorating. So in the year 1900, life expectancy in this country was 47. There was a 10% infant mortality, and those that survived the first year would live to about 52 or 53 on the average. That's where we were in 1900. Women were dying in childbirth. Some other women were having birth injuries. We see some of that today in Africa where they don't have much care. You can see what the untreated situation is. The medicines that were available that I could think of were aspirin, morphine, cocaine, digitalis, belladonna, which is like atropine or scopolamine, probably barbiturates, and there may be others, and there are probably people in this room that know more about this than I do. Anesthetics that were available were ether, nitrous oxide, and chloroform. Chloroform is too dangerous to use regularly. Chekhov, who was a physician and Russian playwright, wrote a play in which he has a doctor who laments the fact that he gave a person chloroform and they died from the chloroform. So since that time, we have had advances in public health. The water you drink is safe to drink almost around the country. We can talk about Flint, Michigan if somebody wants to later. Milk is pasteurized routinely. You can get raw milk places. I don't advise it. What you would avoid by taking pasteurized milk is mostly tuberculosis. We have lead-free gasoline and paint. My epidemiologist brother pointed out to me that the industrialists put the lead in the gasoline and paint early in the century, and they took it out later in the century. We have iodized salt, which prevent goiters in many parts of the country. We have widespread refrigeration so that food does not spoil, and there are fewer adults smoking now than used to. We have safer highways by the design of the highways and by those little marks they put along the side of the road so that if your wheels hit them, you hear your wheels on the side of the highway. We have seat belts and airbags. Back to sleep is for the newborn babies. When you put them down, you don't put them on their abdomen, you put them on their back. There's a lower incidence of sudden infant death syndrome under those circumstances. And we have fluorinated water, which, except in New York County. Immunizations in 1900, the vaccination against smallpox was possible. I don't know how widely it was practiced. But since then, we have developed quite a few vaccines. But the vaccinations against smallpox has led to the eradication of smallpox worldwide. The last case in this country was 1947. And some 20 or 30 years later, there were no more cases worldwide, and the physicians and the epidemiologists are sufficiently confident that it's gone, that we stopped vaccinating against smallpox because there's a small chance of a serious vaccine reaction, so that you can avoid those small chances if you don't vaccinate. So I don't know when we started giving DBTs for diphtheria, pertussis, and tetanus, and the new name for that is the Tdap. Probably in the 30s or 40s. Tetanus, as you know, is a disease of contaminated wounds, and war wounds, there's a lot of contamination. There were thousands of cases of tetanus in World War I. In the U.S. forces with 2 million troops in World War II, there were 18 cases, and a careful review of their records indicated that none of them had been immunized against tetanus. So it's very effective. My mother's older sister died of diphtheria at age 12. So these are, I believe, are very important public health measures. Polio, the last major epidemic in this country was 1955 after the I guess it was the Salk vaccine came out. I can't remember which came first, Salk or Saban. And we heard last week or a week before the success that is being had around the world in almost eradicating polio, so that we will see that as a bygone disease, hopefully in the not too distant future. Vaccines against measles, mumps, and rubella came out. Measles has a case fatality rate of 1 in 400. I have seen people die of mumps. Rubella is the cause of birth defects, and if a pregnant woman has rubella in her first trimester, her child may have serious birth defects. It's going the wrong way. In the early 1900s, we had the advances in clinical chemistry measurements, measuring various components in the blood, such as the electrolytes, blood urea, nitrogen, blood sugar, and various other things. In the 1920s, the physicists developed quantum mechanics. And the significance of that for medicine is that it demonstrated the wave nature of matter, particularly the electron. The limit of the light microscope is around a micron, a thousandth of a millimeter. You can't distinguish points closer together than that. With the electron microscope, you have a much shorter wavelength in the electron, and you can study smaller items so that we can study the inside of cells. And we know a lot about how mitochondria are and how the nucleus is and various other things in cells as a result of that. Early in the 20th century, Krebs and others developed an understanding of how food stuff is metabolized into carbon dioxide and oxygen, and what happens if you don't get oxygen in that metabolism. I'm going the wrong way on this thing. In the 30s and 40s, we had an understanding of isotopes, the structure of the atom. Deuterium was discovered in 1932 by Harold Urey. He subsequently won the Nobel Prize for it. The structure of proteins was devised by some various scientists. The name Linus Pauling comes to mind. And the structure of DNA, Patty Rooney's fellow countrymen, Watson and Crick and others, figured out the structure and function of DNA, which has been hugely important in subsequent developments. I managed to misspell this one, I think. Imaging. So we have had X-rays from early in the 20th century, following Röntgen's discovery in 1894. They were extended, they were improved by adding contrast agents such as barium, the barium sulfate that you could swallow or could be introduced from the other end, so you could see the inside of the organs. In the 1950s, arteriograms were developed. Better contrast agents were developed in the 1980s. Ray Rosen can probably tell you how much that cost York Hospital, but it was very expensive. Nuclear medicine came along in the 1950s, so that you could do radioactive isotope studies of the different organs and different parts of the body, and help in diagnoses. Somewhere in the 1960s to 80s, ultrasound came along, and there were multiple improvements in ultrasounds as they were developed, and they got increasingly sophisticated. They got so they could do more and more, and I believe the prices went up for a while, but I think have come down a bit. The computerized axial tomogram, the CAT scan. I first learned about it in 1974, and it was probably shortly before that it was developed. And initially it was only used for the head, but then it came to be used for the whole body. Magnetic resonance imaging was a few years later, and it is a very sophisticated test, and it is very, very useful in studying some parts of the body, particularly the nervous system, the brain, but other parts as well. The positron emission scans allow you to, that they can be applied to the myocardium, they can be applied to parts of the brain to see functioning of the brain, and they can be applied to see the patterns of spread of cancer. And in that capacity is where I have found them to be very useful. So we've had therapeutic discoveries of various sorts through the 20th century. I put down insulin in 1921. I originally thought it was a little bit later than that, but I recently heard 1921 is the doctors Banting and Best. A fella in Patty Rooney's country named Alexander Fleming noted on agar plates that were growing bacteria that where there was mold, the bacteria did not grow around the mold. And investigating that, they found an antibiotic, namely penicillin. But sulfa drugs came into clinical use in about 1939 and penicillin around 1943 or 44. First in the military and then in the civilian sector. Subsequently, streptomycin came into use. My father had tuberculosis in 1946. He was treated with streptomycin and he survived for 55 years. In the late 40s, there were multiple antibiotics. Tuberculosis has been a scourge of mankind, particularly in 19th century Europe. Major cause of infectious disease around the world today. Names you may know that died of tuberculosis: Franz Schubert, Keats, one of the Bronte sisters. There are two operas in the repertoire where the heroine dies at the end of the opera of tuberculosis. One of them is the most frequently performed opera in the repertoire in this country today, and that's La Bohème. It tells you what the creative people were worried about at the time that was written. In 1900, patients with tuberculosis would be put in sanitaria to isolate them from society so that you wouldn't spread the disease. Later, tuberculosis causes cavities in the lung, and the idea of treating it was to collapse those cavities. And so to do so, they took out ribs from the chest wall to collapse the lung. So a lot of surgical treatment of TB in those days. In the 50s, the anti-tuberculous drugs, in addition to streptomycin, came along. I've listed them there: INH, PAS, rifampin, and ethambutol, and there are probably others that I didn't come to mind when I was making this slide. In the 1980s, the drugs were sufficiently effective, together with public health initiatives, contact tracing, finding people, testing people for TB. If you go into a nursing home today, you're almost sure to get tested for TB. But the sanitaria are closed. Going to a sanitarium is like going to prison. The difference is the people there are nice to you. They're not guards that are considering you to be a bad person. They're medical personnel that are considering you to have a health problem that needs treatment. But beware, because multi-drug resistant TB is out there, and we may see it come back. Viral diseases. Smallpox was eradicated by worldwide vaccination. The flu in 1918, H1N1 flu, killed tens of millions of people worldwide. There's a book called Flu, which details this in great detail. And if you want to read a harrowing story, you can get that book and read it. But it describes the corpses being piled up like cordwood because so many people died. It was tremendous. And fortunately, we have not had a flu epidemic of that proportion since. And if we did, I don't think medicine has a whole lot to offer, because we do not have good drugs against viral diseases. On the other hand, I recommend everybody get the flu vaccine every year. It just makes good sense. Polio, we're close to eradicating polio. It's eradicated in this country as far as I know. AIDS can be controlled in individuals with drugs who do not have a vaccine against it that I'm aware of. The research on AIDS demonstrates the effectiveness of our biomedical research community, how quickly they found this virus, they isolated it, they sequenced its DNA or RNA, whichever it is, and found drugs effective against it. I want to talk to you a little bit about arteriosclerosis. That's what most of us die from. It causes hardening of the arteries, strokes, heart attacks. So the traditional word for preventing it is diet, exercise, stop smoking, and then you can have drugs to help you control your blood pressure, your cholesterol, and your blood sugar to try to prevent arteriosclerosis. Otherwise, you will come to the attention of various specialists that deal with the problems that it creates. Before I talk about mental health, Freud and Jung were active in the early part of the 20th century. Psychoanalysis became an important modality. Later, state mental hospitals had many patients with advanced syphilis. As a teenager, I was appalled to learn that half the hospital beds in the country were in mental hospitals filled with mental patients. And many of them had advanced syphilis. Others had schizophrenia and various other serious mental disorders. So the common mental health problems are schizophrenia, depression, and anxiety, and if there's a psychiatrist in the room, I'm sure I've missed some important diagnoses here. But there are fairly effective drugs against these conditions. The state mental hospitals are mostly closed now. Unfortunately, some of those people are still around as homeless people on the streets. But there are good drugs to treat these conditions. I'll take a break from my slides for a minute and talk a little bit about medical education. The American Medical Association was formed in 1847. Shortly after 1900, they developed a council on medical education. And the first thing that council did was to study the quality of the medical schools around the country. And they appointed a man named Flexner to head up that effort, and the report that was issued bears his name. It's known as the Flexner Report. It's really an AMA report from their Council on Medical Education. But the result of that was that many medical schools were found to be very deficient, and many of those schools were closed. The result of which is medical education in this country is pretty consistently good across the board. There are some places that may be notably better than the run-of-the-mill, but mostly it's pretty good. Subsequently, postgraduate education became important for physicians graduating from medical school. They all had to do an internship of 1 or 2 years. But then if they wanted to specialize and not go into general practice, they would take a residency in some specialty. And there are 24 specialties recognized by the American Board of Medical Specialties. If you get trained at one of these places, then you can go and take the board exam. The first of these was in ophthalmology, I think 1922. My specialty, surgery, is 1937. The American Board of Surgery was formed. And almost every practicing surgeon today has either taken or has attempted to take that certifying examination. The training programs themselves are approved and accredited by the Accreditation Council on Graduate Medical Education. And one of the challenges to me as a program director was to get ready for that review. The quality of hospitals is monitored by the Joint Commission on Healthcare Facilities, healthcare organizations, I guess it is. So coming back to the slides, major advances in surgery. Early in the century, somebody succeeded in removing a diseased esophagus. 1933, the first pneumonectomy by Evarts Graham in St. Louis. 1938 to 45, various operations for congenital heart disease without opening the heart. So it was things like ligating the patent ductus arteriosus, or repairing the coarctation of the aorta, things like that. 1948, closed mitral commissurotomy, and I put down the name of Charles Bailey as a Philadelphia surgeon. 1950, the first kidney transplant between identical twins by Joseph Murray, and we had the privilege of having him speak at York Hospital a few years ago. Unfortunately, he has since died. And that year also, in Paris, René Dubos repaired the aortic aneurysm. Einstein died of a ruptured aortic aneurysm. 1951, a group in the University of Minnesota did open heart surgery with cross circulation. That is, you had a child with a heart defect, namely a septal defect, and you put the parent to sleep on the one operating table, you put the child to sleep next to it, and you put tubes across, and then the parent's circulation supported the child while they operated on the heart. And when I watched television in the early 50s, there was a young man who was Groucho Marx's show. The young man said he'd been the star of his own television show, and he'd been one of the patients that had survived that. I later heard Dr. Lillehei speak about the 35-year follow-up of this group of patients, which was not a normal survival curve, but nevertheless, many of them lived for many years. In 1953, John Gibbon at Jefferson did the first heart operation using the heart-lung machine, or the pump oxygenator. Carotid endarterectomy was first done in that year. First reported by the group from England, Eastcott, Pickering, and Robb. Dr. Robb subsequently came to this country and was chairman of surgery at University of Rochester. But Dr. DeBakey did that operation in the same year. In the 1960s, they started doing kidney transplants, and they had immunosuppression, so they did not have to do them just between identical twins. And the full field of immunosuppression has grown dramatically since that time, and with better and better agents. Liver transplants started in the 1960s. I'm not sure just when. They were a disaster when they first started, but they got to be good at it after a while. The name of Thomas Starzl rises to the top in this field. Heart valve replacements started happening because they had good enough valves that they could sew them in and people could do well with them. The name of Albert Starr, University of Oregon, to the mind. In 1967, heart transplantation was first performed. It was first performed by Christian Barnard, but his fellow resident and trainee, with whom he trained, had done all the research work. Dr. Barnard went to visit him and showed him through his lab, and Dr. Barnard said, "This is going to go." And he went back to Cape Town, South Africa, and he did it. We developed laparoscopic procedures. I emphasize the cholecystectomy here, followed by many other laparoscopic procedures in the 90s and on into this century. The first successful lung transplantation was somewhere in the 1990s by Joel Cooper, who was my medical school classmate. He also developed an operation for emphysema called lung volume reduction surgery. Cardiac diagnostics came along. Before I get onto this, I'll say I have failed to mention major joint replacements by the orthopedists, which started somewhere in the 1960s, and pacemakers. It started being put in for people who had problems with heart rhythms. I don't know when the first EKGs were done. I'm putting down here the 1930s. Cardiac catheterizations, maybe the 1950s. Coronary angiography, 1960, which showed that arterial sclerosis in the coronary arteries was not always diffuse. There were sometimes significant individual blocks that could be bypassed. And that started happening in 1967. EKG monitoring for intensive care units, and somewhere in the 60s. The 70s, maybe the Holter monitor, a device you can take home and monitor what your heart's been doing for a 24-hour period and have it analyzed. And then in the field of electrophysiology, where they study the pattern of electrical stimulation of the heart through various electrical pathways in the heart, and various procedures that can be done if that gets to be abnormal. At one point I had an ablation of such an abnormal pathway. Supportive care to come along, and it's very important. We probably could not do all the surgery and all the big therapies we talk about without it. So in the 20s, early IV fluids would cause fever, so that's what Tyrogen means, it causes a fever. And in the 20s, they learned how to make IV fluids that did not cause fevers. And it was followed shortly by safe blood transfusions once people figured out what the blood groups were. In the 40s, for some of the polio victims, they had the iron lung. They probably didn't use it for much of anything else. In the 50s, and since then, we've had ventilators, and they've become increasingly sophisticated. Dialysis developed by Jacob Kolff in the 50s. Intravenous nutrition by Stanley Dudrick at the University of Pennsylvania in the 1960s. And I put down here pulse oximetry in 1990s. That's that little clip you put on your finger, which you've probably seen, and it tells you what the percentage of saturation of your arterial oxygen is. That device reduced the medical liability of anesthesiologists from class 5, the greatest liability class, down to about class 1 or 2. Because the problem with anesthesia had been that people would forget to give the patient oxygen. But if you had a pulse oximeter on, you found out very quickly that the patient was not having oxygen and you could take care of it. But the pulse oximeter is a very, very useful device. And you can buy them at the drugstore now for about 50 bucks. All right, let's talk a little bit about cancer. Known causes, and there may be causes that I didn't think to put down here. Viruses, and the papillomavirus is one which has recently been of attention because there's now a vaccine against the papillomavirus. It's not cheap. The British National Health Service thinks enough of this vaccine that they're vaccinating all their, 11-year-old girls or 12-year-old girls against papillomavirus to prevent cancers of the cervix and various related organs. Chemicals, and here I include tobacco products because it's the chemicals in the tobacco smoke that cause cancer. Tobacco is probably responsible for, I read an article recently that says it's implicated in the causation of 29% of cancers in this country. It's not just lung cancer, it's not just lung and mouth and throat, but other organs of the body like pancreas and breast, the bladder, prostate, and so forth. As a causative agent, we know that radiation causes cancer, and that's why we're careful with the dosage of radiation. Chronic wounds have been known to have malignant degeneration. Screening and early detection. In the 30s, Dr. Papanicolaou devised a system of staining secretions so you could see if there's cancer cells in them. And that's been applied to a number of other things. The dentists are looking in the oral cavity so that if you have a cancer developing in your mouth, your dentist may be able to tell you there's a problem and you can go to an appropriate specialist to get it taken care of. In the 1950s, there were several studies to see if chest x-rays could have an impact on the death rate from lung cancer, and they did not. Since the turn of the century, there have been studies using low-dose CAT scans, which have had a dramatic impact in a selected group of patients. In the 1960s on, we've had mammography, and it has reduced the death rate from breast cancer by early detection. Sigmoidoscopy and colonoscopy have been very useful in treating or finding early colon cancer. Ronald Reagan went in for a colonoscopy and they found a tumor, and he stayed in a few more days and had his colon removed to treat it. In the early part of the 20th century, the cancer treatment was almost exclusively surgical. And if you talk about breast cancer, they were huge cancers that got treated with not very encouraging results. Radiotherapy, first using radium, later higher energy x-rays, at some point cobalt-60, and various other modalities has come along and has been developed, has become increasingly sophisticated, and is very effective in many ways. Chemotherapy came as a result of autopsies on soldiers who'd been exposed to mustard gas and they realized that all the lymphocytes had been killed. And the dozens of chemotherapeutic agents have come along, and they're getting to be very effective. So in summary, in 1900, life expectancy was 47. The infant mortality rate was 10%. On the average, in the United States, every week throughout the 20th century, life expectancy has increased 2 days. Life expectancy in 2000 is around, I think it's 77, maybe 78. Infant mortality I'm putting down is less than 1%. And I thank you for listening to me.